Do you know the differences between original Medicare and a Medicare Advantage plan? If not, you're in the right place. This video will cover the information that you need to know before submitting a claim for a Medicare patient to a payer for reimbursement. By knowing the key differences between original Medicare and Medicare Advantage or MA plans and how to check patient eligibility, you'll be able to avoid claim rejects and determine whether copays, coinsurance, or deductibles apply to the services rendered to your patient. So let's begin by defining the options available for individuals to obtain their Medicare coverage form. People eligible for Medicare can get their healthcare coverage through either original Medicare or an MA plan, also known as Medicare Part C. Original Medicare is the federal health insurance program for people who are over 65, certain younger people with disabilities, and people with end-stage renal disease. For an individual to be eligible to enroll in MA plan, they must first be enrolled in original Medicare Parts A and B, then choose to receive Medicare coverage through an MA plan. If they choose to enroll in an MA plan, they will still have the same Medicare rights and protections as original Medicare. Let's look at the key differences between the two options. Medicare is offered directly through the federal government and includes Part A coverage, which is inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Part B coverage is for certain doctor services, outpatient care, medical supplies, and preventative services. Medicare also puts limits on how much an individual can be charged when they visit participating or non-participating providers. When the beneficiary is enrolled in original Medicare, they receive a red, white, and blue Medicare card. The beneficiary would also have to consider purchasing Medicare prescription drug coverage separately, which is the Medicare Part D plan. With an MA plan, the Medicare beneficiary already has their Medicare card, but also receives the MA plan membership card. Some of the most common MA plans are health maintenance organizations, or HMOs, preferred provider organizations, or PPOs, and private fee-for-service plans, or PFFS plans. Not only do MA plans vary in benefits, but they can also vary geographically and may not be available in certain areas depending on where the individual resides. If an individual meets the requirement of at least 40 quarters of employment paying into Social Security, they automatically qualify for Medicare Part A coverage with no monthly premium. For Medicare Part B coverage, they will have to pay a monthly premium. They are also responsible to pay deductibles, coinsurance, and copays. If the individual's modified adjusted gross income as reported to the IRS is over a certain amount, they'll pay the standard premium amount and an income-related monthly adjustment amount for their premium. For MA plans, individuals will pay the same monthly premium as those enrolled in Medicare Part B. Most MA plans use only copays instead of coinsurance for the same services, meaning individuals enrolled in MA plans pay a fixed cost. They also have the option to increase their plan's coverage at a higher monthly premium cost if they choose. Costs can change each year, so be sure to check the premiums link titled Rules for Higher Income Beneficiaries provided for you in the resources section at the end of the video. Original Medicare doesn't have an out-of-pocket maximum, so there's no cap on what the beneficiary could pay out of pocket. If they're in the hospital or a skilled nursing facility, Medicare only pays for a certain number of days. After that point, the beneficiary is responsible for the full amount each day unless they have a supplemental insurance plan that would pay some of the cost. With an MA plan, the plan tracks all the costs of the members, including deductible, copays, and coinsurance. Once the member reaches their out-of-pocket maximum, the MA plan pays for most all covered services. The out-of-pocket maximums vary depending on the plan they choose. So be sure to check out the Medicare costs at a glance link in the resources section at the end of the video for details. With our original Medicare, a beneficiary may go to any doctor or hospital in the United States that accepts Medicare. Referrals are not needed to see specialists, and there is no prior authorization required for most services. MA plans have fixed networks of doctors and hospitals and have rules about whether or not an individual can get care outside their network. Individuals usually have to choose a primary care physician, obtain referrals to see specialists, and get prior authorizations for certain services. Medicare beneficiaries have the right to appeal unfavorable decisions regarding coverage of their services regardless of how they receive their Medicare benefits. Timeframes can differ depending on whether they have Medicare or an MA plan. So now that you know the key differences between original Medicare and an MA plan, how do you know what plan your patient is enrolled in? What should be the first thing you do each time they arrive for an appointment? You should ask for their health insurance cards. That's an easy one. So why is this important? Because it prevents you from doing extra work. For example, in 2021, over 600,000 claims were rejected in First Coast jurisdiction due to the patient being enrolled in MA plan, but the claims were submitted to the original Medicare. This increases administrative costs to your organization by having to correct and resubmit claims to the correct payer. What else can you do to keep your costs down and submit claims correctly the first time? You've already obtained the patient's current insurance card, so what's next? You'll want to verify your patient's Medicare eligibility and benefits. You may do this through our Secure Provider Online tool, or SPOT, or through our Interactive Voice Response System, or IVR. If your patient is enrolled in Medicare Advantage, you'll get the patient's enrollment information, the plan type, and the name and contact information. If the patient has disenrolled from the plan, you'll also get the disenrollment date. And in that case, the patient's traditional Medicare benefits would resume on the first day of the following month. If there's any discrepancy or conflicting information, you'll want to reach out to the MA plan, the patient, or their representative regarding the discrepancy. And finally, if your patient's record needs to be updated, the patient or the representative needs to contact the MA plan or call 1-800-MEDICARE. Now that you know the key differences between original Medicare and an MA plan, and most importantly understand the steps you should be taking before submitting a claim, you'll be able to avoid claims rejecting, as well as saving yourself time and your organization the additional cost. Be sure to check out the resources in the resources section following the video. Also, don't forget to subscribe to our YouTube channel to access additional educational videos. And as always, thanks for watching.